Hello everyone, I am Dr. Harini Sreedharan, Consultant Neonatologist at Mazumdar Shaw Medical Center, Bomsandra, Bangalore, Narayana Multi-Specialty Clinic, Niladri Road, Electronic City and Sarjapur Road. Today, I am going to be sharing a few tips to keep your baby comfortable this summer. As the temperatures are rising, we all drink additional water and fluids to maintain our cool. And during this time, it is very important to continue breastfeeding our baby on demand. Breastfeeding and formula not only satisfy the hunger, but also satisfy the thirst of the baby. During this period, the babies do not require any additional water, as giving additional water would not only disturb the water and electrolyte balance of the body, but would also not lead to adequate weight gain, as water does not contain any calories. Also, there is an increased risk of picking up various waterborne infections from additional water. So please continue breastfeeding or formula feeding if indicated on demand of the baby. Breastfeed or formula contain the adequate amount of nutrients, electrolytes and water which is required by a baby in the right combination, which is not only essential for their growth but also essential for their brain development. The formula has to be prepared or reconstituted according to the instructions as mentioned by the manufacturer. It need not be too dilute, as doing so would again change the water and the electrolyte balance. So please continue breastfeeding and formula feeding your baby on demand. The mother who is breastfeeding should take adequate amount of fluids and water, as the breast milk contains 90% of water. The mother's diet need not be changed during the summer, as that would not impact her milk supply or would impact the baby's hydration in any way. We always wonder what should be the surrounding temperature we need to maintain for our baby during the summer. We all know that during the winters we need to adequately cover our baby. During the summer, we may need to reduce the number of layers of clothes that the baby wears. The baby should be comfortable. The baby should not sweat too much, as too much of sweating would cause rashes all over the body of the baby. At the same time, in case of low birth weight babies, premature babies, or other babies with health conditions, it is important to make sure that they do not get too cold. We can judge this by checking the temperature of the arms and the legs with the temperature of that of the tummy. If the arms and the legs feel too cold, then your baby may require additional clothing. A ceiling fan or an air conditioner may be used accordingly if it gets too hot. The air conditioner can be used around the temperature of 24 to 28 degrees Celsius. Using a ceiling fan or an air conditioner will not increase the likelihood of your baby picking up a cold or a cough. It is very, very important to keep your baby comfortable and prevent your baby from sweating, as it may lead to a lot of weight loss in case of a very small baby, or rashes, or may dehydrate your baby. Preferably, cotton clothes are advised, as they allow the skin to breathe through. General products which are normally used can be used. The use of talcum powder is generally discouraged, as it may be harmful to the health of the baby. Either cloth napkins or diaper can be used as per your preference. It is very important to change the cloth napkin whenever wet and the soiled diaper at frequent intervals, say every 2 to 3 hours, even if your diaper is dry. This will prevent any diaper rashes from affecting your baby in the summer. And at the slightest sign of a rash, if there is any redness, application of a diaper cream will prevent it from becoming worse. So these are a few tips you can use to keep your baby safe and comfortable this summer. Now, how do we know whether our baby is adequately hydrated or not? If it is an older baby, your baby, if thirsty, may increase the quantity of feeding, may feed more frequently. As long as your baby is otherwise comfortable, gaining weight, passing urine and stools normally, it should not be a matter of concern. And if your baby becomes very irritable on being covered or develops a fever, then it may be a sign that you are over-covering and you may need to reduce the number of layers of cloth. It is very important that we do not tightly swaddle the baby and give the baby some space to move around. This will also help create air pockets which will maintain the temperature around the baby. In the case of a very small baby or a preterm baby or a newly delivered baby within the first 2 weeks of life, if the baby is dehydrated, then the baby may become very dull, the baby may be lethargic or may be very irritable. The urine quantity would start decreasing and would be either dark yellow in color or pinkish in color, which are signs of dehydration in the baby. A baby who's not having adequate feeds in the initial few days may also pass less amount of stools. So if you find any of these signs in the baby, along with worsening of the jaundice, that is the yellowish discoloration in the baby's eyes or in the baby's skin, then you would need to review the baby with the doctor immediately. So please continue feeding your baby in summer, be well hydrated yourself, and that will help your baby a lot. Thank you.